Hodgkin lymphoma, also known as Hodgkin's disease, is a type of lymphoma, which is a cancer originating from white blood cells called lymphocytes. It was named after Thomas Hodgkin, who first described abnormalities in the lymph system in 1832. While it is a relatively rare disease, understanding it is crucial due to its impact on the lymphatic system, which is part of the immune system. Hodgkin lymphoma can occur at any age, but is most common in two distinct age groups: early adulthood, especially in people in their 20s, and late adulthood, after age 55. It is characterized by the presence of Reed-Sternberg cells, which are large, abnormal lymphocytes that can be identified under a microscope. The exact cause of Hodgkin lymphoma remains unknown, but several risk factors have been identified. These include a family history of the disease, being male, having a history of Epstein-Barr virus infection, and having a compromised immune system. While these factors can increase the likelihood of developing Hodgkin lymphoma, they do not guarantee that a person will get the disease. Symptoms of Hodgkin lymphoma can vary but often include painless swelling of the lymph nodes in the neck, armpits, or groin, fever, night sweats, unexplained weight loss, and fatigue. Sometimes, patients may also experience itching, alcohol-induced pain in lymph nodes, and persistent fatigue. Because these symptoms can also be associated with other conditions, it is important to see a healthcare provider for an accurate diagnosis. The diagnosis of Hodgkin lymphoma typically involves a combination of physical examinations, blood tests, imaging tests, and a lymph node biopsy. During a biopsy, a small sample of tissue is removed from a lymph node and examined under a microscope to detect Reed-Sternberg cells. The presence of these cells confirms a diagnosis of Hodgkin lymphoma. Once diagnosed, the staging process begins to determine the extent and spread of the disease. This is crucial for planning the most effective treatment. Staging involves further imaging tests and sometimes bone marrow biopsy to see if the cancer has spread to other parts of the body. The stages range from I, limited to one lymph node region, to 4, spread to multiple organs beyond the lymphatic system. Treatment for Hodgkin lymphoma depends on the stage of the disease, the patient's overall health, and other individual factors. The main treatment options include chemotherapy, radiation therapy, and in some cases, stem cell transplant. Chemotherapy uses drugs to kill cancer cells and is often the first line of treatment. Radiation therapy uses high-energy rays to target and kill cancer cells in specific areas. In advanced or recurrent cases, a stem cell transplant may be an option, where the patient's diseased bone marrow is replaced with healthy stem cells to help regenerate new, healthy blood cells. Hodgkin lymphoma has a high cure rate compared to other types of lymphoma, especially when detected early. With modern treatments, many patients achieve full remission and go on to live healthy lives. Follow-up care is essential to monitor for potential recurrence and manage any long-term side effects of treatment. Research and clinical trials are ongoing to find new and more effective treatments for Hodgkin lymphoma. These studies aim to reduce side effects and improve outcomes for patients. In summary, Hodgkin lymphoma is a serious but highly treatable form of cancer that affects the lymphatic system. Early detection, accurate diagnosis, and proper staging are critical for effective treatment and favorable outcomes. Patients with Hodgkin lymphoma should stay informed, work closely with their healthcare team, and consider participating in clinical trials to access new therapies. With continuous advancements in medical research, the prognosis for Hodgkin lymphoma patients continues to improve.